The Falls and Fracture Resource came out to Balmedy here in 2011. At that point, it was in September, and we introduced the assessment pack. After that, we were able to introduce the first part, was where we were identifying the pattern of falls. The lounge area we identified by using one of the tools as the high-risk area, where there had been 12 falls in a month. We introduced a new shift plan where it allocated a member of staff in that area at all times, with a changeover after half an hour. In 2012, we reduced our falls in that area to 12, and in 2013 to 3. So by introducing a small tool, prevented falls in a high identified risk area. As a manager, we have a huge responsibility regarding the personal development of a staff team. This tool can provide that, not only for the prevention of falls, but in all other areas, identifying risks for the health and safety officers, providing evidence for staff who are doing SVQs, where they are given the opportunity to be involved and develop into an area they might not have thought they could even have done.
If we do obviously identify risks, we can convert this into our care plans, as I am a key worker, for service users. I found this very beneficial because it's prevented people becoming breathless from maybe carrying, as I say, from the Zimmer frames, because if they're carrying a lot of items on their arms, this can also prevent them to become very breathless because they're too busy occupying of what to hold. So it has prevented falls. It
has developed key workers to be more confident in making care planning, and it's also given the families the reassurance that the care staff are interested in how to keep their loved ones safe. I find if anyone's starting in the pack, the best place to take is do the first part, which is your self-assessment. See what stage we're at. It can be a pleasant experience because sometimes we're doing a little better than we think. As a manager, and most managers will have, where we have to do audits on things, I find having these tools where it is a tick box, it's easy to explain, it's in a jargon that's easy to understand, makes my life easier when it comes to auditing.
So within the past 4 months of obviously achieving the falls prevention, I'm finding that obviously with doing care planning, that has given me a positive outlook for completing my care plans and the understanding and the ability to achieve obviously my risk assessments correctly and to prevent any falls or risks or harms to the service users that I look after at Balmedy House.
I just feel that the motivation has to come from the management, because I know for a fact if I had left that on the shelf and the motivation had never came from me, I would not be sitting here today saying that I have had no admissions to hospital. And that's a fact.